My name is Ellen, and I'm the Programs Coordinator at Arthritis Consumer Experts. Welcome back to the 8th Annual CR Arthritis event. Today, I am joined by Dr. Zahi Touma, rheumatologist and clinical epidemiologist at the University of Toronto, whose research is focused on patients with systemic lupus, as well as measurement science with a particular interest in the assessment of disease activity, patient-reported outcomes, and cognitive function. Dr. Touma is a member or the co-chair of the American College of Rheumatology Committee for the Development of Classification and Response Criteria, and he also co-leads the Outcome Measures in Rheumatology Working Group with two colleagues in the United States, otherwise known as AMRAC. Thank you so much for joining us, Dr. Zahi Touma.
Thank you for the invitation.
Wonderful. And, getting really excited to talk about lupus because I think it's one of the conditions that we don't know so much in the world of arthritis. Can you share with us, why is it important to have standardized measures for lupus? And what are some of the measures that rheumatologists use to diagnose and monitor disease status today?
So, measures are very, very important in any field of work and science and research and daily practice as well, because it will standardize the way you're sharing information with the other person. So let's just give you an example. And measure could be an instrument. Some people call it tools, indices. And if you want to measure, for instance, disease activity or quality of life or fatigue, it would be very important that if you're measuring, let's say, disease activity in lupus patient, that the majority of the people use the same instrument. Then if you see the patient on follow-up from baseline to 6 months and you use the same instrument, you will be able to see if there is a change. At the same time, if you are in a clinical trial and you're running a clinical trial internationally with different countries, so it's very important as well that no matter where you are in the world, you're using the same instrument, then you can compare the results. So you can see really it's very important. And when you standardize, when you're able to measure something in life, you will learn about this concept that you're measuring, and you know how to improve probably things down the road.
Well said. Thank you so much. If you can measure it, you can learn about it. If you can learn about it, you can improve it. Thank you so much. Our next question is, can you describe some of the differences in symptom manifestation between lupus and other kind of more common rheumatic conditions?
Yes. So first of all, there's a difference between different rheumatic diseases, and probably the population or the patient who develop the disease are different in terms of characteristics and age group and other as well patient characteristics. So particularly for lupus, as you know, is we see it around the age of puberty, and we see high predominance in female compared to male patient, at least with a ratio 9/1 after the age of puberty. And we see it particularly around the childbearing age. Lupus itself, it's an autoimmune disease that can involve multiple organs. This is why the same patient can present with different manifestation, and depends which organ is involved. Yes, you can get arthritis with lupus, but at the same time, you can also get skin rash over the face or over your body, hair loss. It can affect as well the internal organ. So if the lupus involve the kidneys, you might develop what we call proteinuria, which is when the kidney is leaking protein. And if you don't address this problem, it will affect the kidney function, and patient might end up, unfortunately, with end-stage kidney dialysis, or what we say when we say the patient needs a dialysis or kidney transplant. It can affect as well the heart and give you chest pain or inflammation in the heart itself, and can develop a lot of symptoms. It can also involve different part of the nervous system, particularly if it goes to what we call the central nervous system. It can give symptoms such as psychosis, depression, anxiety, seizure. So really the spectrum of the symptoms that you can see manifestation with lupus is very, very wide. And something unique as well about lupus is that we call it as well the disease of thousand faces, because every patient is different. It's a very heterogeneous disease. When you compare patient to patient, the manifestations are different. And this is also what makes the diagnosis of lupus challenging. You have to have expertise, and you need really to have a very thorough history and medical exam before you get to the lab. The lab is very important. By lab, I mean blood test, imaging, and everything related to this. But really things start what the patient tells you. You have to listen very carefully to history and do a very thorough exam.
Absolutely. And like you said, the diagnosis is so difficult to differentiate. And please, correct me if I'm wrong, but is fatigue said to be one of the kind of the hallmark or first symptoms that it seems relatively consistent?
Thank you for asking this question, because one of the early symptoms in lupus, or one of the most commonly reported by patient, is fatigue. Fatigue, yes, it can be seen with other diseases, but it's something unique about fatigue, that it's highly prevalent, means it's present in many patients with lupus. And again, it's a very early sign. Even before you make a diagnosis, you meet the patient and you make a diagnosis of lupus, the patient can tell you that I've been experiencing this for probably a year or 2 years, and nobody could explain why I'm developing this. And the challenge with lupus is, by the time you put all the pieces of the manifestation that the patient is reporting together, and then you can make a diagnosis of lupus. So what I'm saying is that, and often in some patient, you don't see all the manifestation right away. And this will make the diagnosis challenging. And often patient comes in, they say, I've been dealing with new fatigue for the last year or 2 years. Then I start developing hair loss and rash over the face, and you do the blood test and you confirm the diagnosis. And the challenge with fatigue, sometimes we call it as well multifactorial, which means part of it is probably related to the lupus itself. But even when you give medication, let's say if the patient has arthritis and skin rash in addition to fatigue, the medication that we use often, they don't control fatigue. Sometimes it will be improved or completely resolved, but in some patients it doesn't. And this is where, when we think about multifactorial causes of the fatigue. So sometimes, just to give you an example how this can be challenging, if you have an ongoing inflammation, it might drop your hemoglobin, or if your iron is low, it might drop your hemoglobin, and anemia itself can be associated with fatigue, right? Mm-hmm. If you're not sleeping well, and your sleep is disturbed, this can as well lead to fatigue. And it's a vicious cycle. You don't sleep, then you get fatigue, and goes into this vicious cycle. And sometimes some of the medication that we use can as well, it's supposed to help you with the lupus, but it can have adverse event such as fatigue. And one of the common medication, just for instance, methotrexate, is an immunosuppressant that we often use for the lupus treatment. It can give you also fatigue. So this is why really it's complex. And in some patients, we say it's a multifactorial kind of concept or construct.
Very interesting. And yeah, I've never thought of it that way. You can be sleepy tired, but you can truly be, I don't have the energy and I can't do a hard aerobic exercise because I don't have enough iron to transfer the oxygen to my. So like you said, the concept of fatigue is really just very multifactorial. There's so many different ways of thinking about it. Thank you for that.
And Ellen, exactly as you mentioned, it can be experienced or referred by the patient differently. Fatigue, tired. And if you look at the questionnaire, which we define them as patient-reported outcome, some of the questionnaire that the patient complete, it has different items for fatigue particularly, and will ask you, are you tired? Can you do this task? So fatigue is not just the fatigue that you feel. It's really, it's a difficult concept to explain, because some people, the fatigue for them is difficulty doing their job or doing their task, while for other people, the fatigue is preventing them from sleeping or having good quality of life. So you can see how complex this concept as well itself to define and to capture from different angles.
Very, very interesting. And that the fact that, now you're in the field of trying to measure this is so cool to me.
Exactly. Yeah.
And Dr. Touma, what are the current treatment options for lupus? And are there any kind of therapies that are coming down the pipeline, you can say?
Absolutely, and I'm very happy to say this and share the information with you, because over the last 3-4 years, we really have been more successful with the drug trial for lupus. So in the past, it took us probably really up to 4 decades to approve a new biologic for lupus patient, and it's been available for the last 10 years at least. But more recently, over the last 3-4 years, we've been able to get more medication approved for lupus. So we have seen recently specific medication for lupus nephritis, and this is again when you have inflammation in the kidney. We do have as well a new drug that was approved to what we define as moderate lupus activity, which means in simple word, when the patient presents with arthritis, joint pain, or a skin rash, or chest pain that could be related to pleurisy or pericarditis. And there is in the pipeline a number of biologic and new treatment which are in phase 2, and the results are very promising. So hopefully the new years will give us more drugs for lupus patients. Absolutely.
And I think you brought the point around where, because all of the manifestations are so unique, we need more treatment options, ones that are able to address the needs of that individual person. So that's absolutely fantastic.
And I like how you said it. It's very correct what you said, individual patient, because not all patients are alike. Remember, we said it's a very heterogeneous disease and disease of 1,000 faces. And probably it is different because the underlying mechanism is different from patient to patient. And you need to target different pathways to stop a disease in every patient. So this is why we need a variety of medication that can help us to control lupus.
Variety of medications, a variety of ways of measuring. This is just what an exciting time in this field.
Absolutely.
And Dr. Touma, on a kind of more wellness or holistic note, do you have any tips or resources that you can share with patients with rheumatic conditions, patients perhaps with lupus, that can help them improve some of their health outcomes without medication?
So it's very important to learn about your disease, and this is here the job and the work that should be done between the healthcare providers, physicians, nurses, and other healthcare allied to help the patient understand their disease. Because if you don't have this done, I don't think you can achieve good outcomes. And always the outcomes are better if the patient know what's the extent of their disease, which organ is involved, and why it's important to take the pills, right? Because some of the manifestation of lupus, such as skin rash or hair loss or joint pain, it's probably a bit easier here to explain to the patient what's happening, and we see the results. When you give medication, the skin rash disappearing, the joint pain improving. But when you have internal organs such as lupus nephritis and you're measuring proteinuria, it's sometimes difficult if you don't explain to the patient what are you doing, and you just say, I want to improve the proteinuria, and the patient say, and why this is important, and you're giving me a lot of prednisone that has a lot of side effects. Why should I take this medication? So again, talking to the patient is very important, and make sure they know about their disease and learn about the medication potential benefit and adverse event is very important. So set the goals ahead of the time. Okay. Now back to your question, how can we facilitate this? Yes, you can read on the internet, but you have to be careful what you're reading. Okay. So this is why when I meet the patient in the clinic and we work together, and we have a large team here as well, including the lupus nurse with us who facilitate this phase. We introduce the patient to different websites where you can find a material that you trust, valid material. As well, we have a brochure in the clinic that we provide regarding the manifestation, or if the patient want to learn about any medication we're starting, we have as well brochures to help with this. So some of the, if you ask me in general, where can we read about this? I mean, there is a lot of good information on Lupus Canada, the Lupus Foundation of America, and other as well sources.
We will definitely link those in a kind of below the video so that everyone can check them out in case you do want to learn more. And like you said, being really careful with what we read on the internet, and going right to the source, going to the rheumatologist, seeing if they perhaps and know of any very trustworthy resources. And I think that also shows. Please correct me if I'm wrong. If a patient is asking you for resources and they're you can tell that they're engaged, that also is kind of reassuring as a rheumatologist. Is that correct?
Absolutely. And it's much easier to work together as a team. And to work together as a team, you want to make sure, again, back to the instrument, that we all speak the same language and we share the same knowledge. So this is why it's very important to help the patient understand their disease.
Wonderful. So your wellness tip for this episode is to gain information, and if you're a rheumatologist listening in, is to speak in that same language as best you can with your patients.
Exactly.
Awesome. And any last things you want to add or to share with our audience today?
I want to say the last message again, that the future looks promising, particularly in terms of treatment. And this is how we started the session today. Really, we've been very successful over the last few years getting new medication. And hopefully in the coming new years, we're going to see more medication for lupus. It's time to make a change in the patient life, particularly living with lupus.
Wonderful. So thank you so much, Dr. Zahi Touma, for your time, for your expertise, and really what a fantastic conversation today.
Thank you again for having me here.
And have a great rest of your day. Bye, everyone.